Okay, well, good morning, everyone. So, I'm Dr. Saqib Shahab. I'm the Chief Medical Health Officer for the province of Saskatchewan. So, as you have seen in the news release, we have announced something that we were expecting for a while now, that we have our first confirmed case of COVID-19 in Saskatchewan. As you know, for several weeks, we have been diligently asking travelers to, when to self-monitor their symptoms, to self-isolate, to contact Healthline or the healthcare provider if they have fever, cough. And so in this instance, it was a person who had traveled from Egypt. Egypt is one of the several countries listed on the WHO website that is showing community transmission. The individual developed symptoms on March 9th after arrival in Canada and was tested and found to be positive. That result was announced this morning. The individual is comfortable isolating at home, like the majority of cases in Canada. Individual has had very little contact with anyone else, apart from one person in the house. So public health is diligently following up with the individual, their movements while in Canada and in Saskatchewan to see if there's any contacts that need to be informed to self-monitor themselves. And the main message for this particular instance is that the general public does not need to be concerned. Public health will contact anyone who needs to be aware. In terms of our risk assessment, we've been saying for some time now that with several cases in Canada being reported due to travel, we were expecting to see a case at some point. We will expect to see more cases in the future, primarily linked to travel, but we remain vigilant to also detect cases which may not have traveled. And this leads me to the general principles that we have been enforcing, that anyone, irrespective of travel, if they have a cough or fever, stay home. Anyone who is outside, practice good social distancing. Avoid shaking hands, cough in your sleeve, wash your hands frequently or use a hand sanitizer. And especially if you have traveled anywhere in the world, or if you have attended a conference or a large gathering, even anywhere in Canada, when you come home, you can go about your daily business, but closely monitor yourself and your symptoms. Ideally, you can take a temperature twice a day, and at the first sign of fever or cough, self-isolate. Don't go to school, university, or work. Call Healthline to see if your symptoms need further assessment and testing, and get tested if that is the recommendation. And we hope that through this process, we will continue to quickly isolate people who have COVID-19. Many individuals will remain well enough to stay at home till they have cleared the virus, and their close contacts will similarly be asked to self-isolate for up to 2 weeks and will be monitored for symptoms. And this is what we need to maintain for as long as we can to prevent further community transmission in Saskatchewan.
So you said, I think, that this individual only had contact with one other person in Saskatchewan within their own home.
Yes.
Can you explain again what's being done with that person presently, and how confident you are?
So that person is also being monitored by public health, and if they develop symptoms, they will be tested. But I think that is a really important point, that all travelers are already aware now that they are to self-monitor their symptoms and immediately isolate, which includes going home from school or work if they develop any symptoms, especially after travel and especially after attending a large event or a large gathering anywhere in Canada also.
Did the person travel in an ambulance or go to the hospital?
I am not aware of those details, but it was testing was done in a primary care setting, and that is what we want. We want most people who have traveled, they have mild symptoms, they're otherwise well. We want them to call Healthline. In many cases, testing can be done in the home. In some cases, testing is done in a way that the person is asked to call ahead to the primary care office so that you don't sit in a waiting room. And obviously, if someone is very unwell, then testing can be done as part of other care in a hospital setting. In this case, the testing was done in primary care. But I think that is an important point, and as travelers with symptoms who require testing, all options are being considered, including setting up in some of the larger centers, assessment sites where you can go directly after talking to Healthline for assessment and testing in a very streamlined way.
Can you share that primary care facility?
No, that information should not be shared. That's confidential information both for the person and also for the care providers. But I have to, reiterate that we have now done 285 tests in Saskatchewan, 1 presumptive positive, 263 negative, 22 results pending. So the same process is followed every time, and we will occasionally see positive cases, and public health follow-up will happen in every case that's positive. So this will not be an uncommon event, and it needs to just flow in a streamlined way. But I think the main thing is that it's up to all of us to do two things. One is practice social distancing, and second is to seek testing and assessment if we develop symptoms. I think that is the main message for all of us going forwards.
Can you clarify the gender of the first presented case, man, woman?
It is not really useful for public health purposes, but we generally try to avoid that. And we have to be mindful that we are talking about individuals. In this case, the individual arrived in Saskatoon. In future, there may be individuals in small communities. And we'll have to be very mindful about even naming if individuals test positive in future from small communities. I think we do need to protect from our side privacy and confidentiality of people who have traveled and have tested positive. And that will be in future, there will be very limited personal details given. But in this case, we did mention the country of travel was Egypt. That's important. But we have to remember that in Canada now, importations have happened from many countries in Canada, from the US, from several of the high-risk countries, but also from many other countries in Europe, not just Italy, but other European countries, from other countries throughout the world. And I think we need to keep that in mind, that we need to treat people who develop symptoms very respectfully, protect their confidentiality, and at the same time really encourage people to present in a way that they feel comfortable, that they will be assessed in a respectful way, they will be able to manage at home with supports by public health and family and friends, and that is going to be the way going forward.
Why is your message to travelers to self-monitor, and then if you present symptoms, go seek testing and self-isolate? Why is the message not travelers, make sure that you self-isolate regardless of any symptoms?
Yeah. So that's a really important point, and travelers who travel from countries with the highest level of risk, and those are level 3. Currently, they are China, especially Hubei province, Iran, and Italy. They are given direction by federal border services on arrival to Canada to self-isolate for 2 weeks and to call if they develop symptoms, to call Healthline if they develop symptoms. That is also the direction for close contacts. If a case presents with fever and there are other people who are living in the household with that person, close contacts, their direction is also to self-isolate because they are at the highest risk of developing infection. But there are thousands of people who come after traveling from abroad. There are thousands of people who attend conferences or large gatherings. It is not practical for them to self-isolate for 2 weeks. We also know through studies now done on tens of thousands of cases in China and Italy and other places that transmission happens through close contact, not airborne, and transmission happens when people are symptomatic. People may have very mild symptoms. You may have a dry cough, a slight fever, which you didn't measure, and that's where transmission can happen. And that's why we say the self-monitoring has to be very precise. Recommend having a thermometer. We have an information sheet on self-monitoring on the website that has actually a table with 14 days that you should record your temperature morning and evening and monitor other symptoms. And so that's for self-monitoring. And once the 14 days are over, you're fine. That's good. You don't have to call anyone. You're free to go about your business. And then if you need to self-isolate, we have another information sheet on the website that tells you what that means in the house for you, what that means for others in the house, and so forth. But self-monitoring, while it's not self-isolation, we do recommend that you don't go to large gatherings for the 2-week period. And if you do happen to find yourself in a room with lots of people and you feel unwell, leave. Don't stay on. I think those are some additional recommendations that will minimize exposures to others as much as feasible.
Doctor, you said you had 2 pending cases yesterday. I assume the one has been confirmed.
I'm sorry?
Yesterday you said you had 2 pending test results.
So today, for example, we have 285 people tested, 22 pending, 263 confirmed negative, and 1 presumptive positive. So this information is updated on our website. So 301 total tests. So all that pending means is that it takes from 1 to 3 days to get the test results. So that's all it means. It doesn't mean anything more than that. I'll go here and then there.
Why does the test need to be sent to Winnipeg to be confirmed? And does that pose a problem with the length that it takes to confirm these things?
So initially, 5-6 weeks ago, all tests were going to Winnipeg. Now, over the last 3 weeks, all tests are done at Roy Romanow Provincial Lab. Because we are just now getting to see positive cases, we still send them to Winnipeg as an extra check. But we fully expect that all tests that are presumptive positive will be confirmed positive because the lab is very confident that they have established a platform that is, similar to the Winnipeg platform. But for the first few tests that are positive, we will always seek confirmation, and then over time we will be testing independently, like in BC and Ontario.
Where this morning?
So very reliable sources informed us this morning that there might be 2 cases at the Pasqua Hospital here in Regina, and that the health authority has been told to keep it hush-hush until they're confirmed. How much truth is there to that claim?
So it is our commitment that we will announce the cases as soon as we confirm them, like in this case. So I have not heard of any, it is a notifiable illness. So as soon as a test is reported, it has to be notified to me. So I have not received any indication so far. But this is an ongoing process. So if tests are in process, we will definitely hear of that. And rest assured, we will announce that as soon as we have confirmed that the test has been. But we do wait for information to be given to the patient first. That's out of respect for the patient. It is someone's test result. The patient should hear first from the clinician, and then we announce. So that's the process.
And then the person who came from Egypt, you said there's 1 person that they've been in close contact with. With them self-isolating, are they okay to isolate together, let's say, like in the same house? Like, would that be the thing where they have to be in separate rooms for 2 weeks?
In a household setting, if a person has traveled and has a fever and cough, they are to self-isolate and seek testing. They are then labeled a person under investigation. If the test is negative, they should still remain in isolation till they're better. If it's positive, that all their close contacts till the time, during the time that they were symptomatic, become close contacts. Till a test has been confirmed, we don't recommend cohorting. But you're right, if in a household both people tested positive, they would have less concern of reinfecting each other because both are positive. But over time, obviously, you still need to maintain some separation because one person may clear the virus earlier, one may take a bit longer. So you just have to use those considerations. I'll go here, and then I'm trying to make sure everyone gets a chance. So I'll go here, there, and there.
Thank you.
So what's the criteria for people being tested? Alberta has said that all swabs are going to be tested for COVID-19 at this point. Is it just travelers? Is it all swabs that come in are going to be tested for COVID-19?
So really important question. Our first priority is obviously to test people who have traveled. That's the highest risk. And of course, close contacts if they develop symptomatic. But we are recommending now that anyone who develops a severe respiratory illness, irrespective of travel, and no other cause has been found, they should be screened for COVID-19. Similarly, any outbreak in a long-term care facility where another viral illness has not been found, like influenza, they should be screened for COVID-19. This is an extra layer we're putting in place to make sure that we don't miss community transmission.
Why not say all swabs?
For influenza, we don't test all swabs. First of all, for influenza, testing is only done if clinically necessary. Here we're saying If you travel and have mild symptoms where you will not seek care, otherwise you do get tested. So we think this is the best way to get an early warning. But certainly, there is a plan to broaden that, especially as influenza season is winding down, because as we get into the spring, it'll be unusual to have influenza-like illness. And if we get that, you're right, at some point, all swabs may get tested, irrespective of history of travel, and that is happening in the hospital setting and in the long-term care setting. So I'll go here, then.
What happens for people who don't have health cards? Do they have to pay out of pocket?
Yeah.
And also in regards to the 811 line, is it backlogged and is it because of testing?
It's a really important question, and right now, because this is a public health issue, there is no restriction on testing, irrespective of your status. You may have a Saskatchewan health card, you may have a health card from another country, you may be visiting as a student or a visitor. It does not matter. The testing will be done irrespective. There and then there.
Experiencing delays, long waits.
I'm sorry?
The helpline seems to be experiencing long waits for calls or even ringing busy. What's the province doing to handle that?
So there's three things happening regarding that. First of all, we are encouraging, Healthline is saying a lot of people are going to Healthline or ER with just general questions. And so really that's a message for all of us. There's really good information on the saskatchewan.ca/coronavirus site. It has links to information, general Q&As for workplaces, schools, universities, for the general public. It has links to travel advice. It has links to signs and symptoms. It has information about mass gatherings, what to do if you plan to go to an event. So we encourage everyone to go to that website, get informed about COVID-19. If you have general questions, that should answer most of your questions. If you have symptoms related to travel or otherwise, that's when you should call Healthline. Healthline is also expanding their capacity and also streamlining the calls. They are trying to triage calls so that if you call, they'll say, is it related to concerns about COVID-19? Have you traveled, have symptoms? Then you go to a certain group of professionals who will then streamline your assessment, and other callers will go to another stream. So they are streamlining. And in future, we are looking at, obviously, the need for independent assessment sites that will also take the pressure off, not just Healthline, but people may be going to the physician offices with general questions. So we are trying to ramp up the capacity to advise, assess, and test as demand increases. And it's very important. We don't want anyone with fever not able to and travel, not being able to get tested in a timely way.
If it rings busy, though, should people keep calling?
At the moment, we do advise to wait. I was informed that the wait was as long as 20 minutes, but there were some people who had hung up. So I hope people can then call again at a time which may be less busy. But I will make a note to Healthline to maybe give some advice about what are less busy times, and maybe that would be something that could be helpful. Up there, please.
I had the same question about the 811 backlog. So are you saying basically, in what ways are you expanding capacity?
Yeah.
Like, are more people going to be taking those calls? Because we are hearing that the waits could be up to an hour. Some people are.
So there's kind of three levels of that. One, that they are saying that a lot of people are calling with general questions. So I don't think that's appropriate use of Healthline. I think people should really go to the website and look up the information, read up, and not use of Healthline time to answer general questions. Secondly, Healthline is trying to streamline and triage calls so that calls related to travel and symptoms will go to a small group to just make that process flow quickly. And then the assessment centers, as they're set up, they will also streamline the process so that it's still to be decided whether they will be referred through Healthline or would be able to go directly. But that will also, because a lot of the time the Healthline will then work with public health or with the primary care practice to figure out where a person should go. And that takes a lot of time and back and forth. We're just trying to streamline that process as well. So I want to make sure I'm not missing anyone. So I'll just.
Website URL, I'm not sure if you.
Sorry?
What's the website URL? I'm not sure if you mentioned
So it's saskatchewan.ca/coronavirus. And I think it's maybe on the news release. It is at the end of the news release. So here, and here. So
Just to come back to this first case, could you explain when this person returned to Saskatchewan from Egypt, and further, whether they visited any communities besides Saskatoon?
the information we have is that travel was back on March 6th. Testing was done on March 9th. Public Health is reviewing the case history in detail to confirm whether there were symptoms during travel and what were the activities. But our information to date suggests that, like many travelers, they were very aware of the need to self-monitor and self-isolate, and there was minimum contact with anyone outside of their home while symptomatic.
Were they in any other communities besides Saskatoon?
I do not have that information, and my initial answer would be no.
So when it comes to the 2-week isolation, and you are showing high fevers for all 14 days, or all 13 days, and then the 14th day, you're finally fine. Are you okay to go to work the next day, or should you take another couple days?
Yeah. So most people who have COVID-19 present within the first 8 days. The 14 days is the outer limit. So if you've come home today, you monitor yourself for the 14 days. If you have no symptoms after 14 days, it's unlikely that you have COVID-19. If you develop like fever and cough on the 15th or 16th day, COVID-19 is unlikely. You can still seek advice if you have concerns, but it's unlikely. Most people actually present in the first 8 to 9 days. If you develop a fever, you should really seek advice as soon as you develop a fever. If it's not COVID-19, you do what you do with any respiratory illness, stay home till you're better. If it is COVID-19, then your period of isolation is determined by your clinical course. Most people recover at home. In some cases, it may take 1 week, 2 weeks. But if you test positive COVID-19, then currently the advice is once the symptoms have settled, you do need to be retested to make sure the test is now negative before you can go back to school and work.
So should it be 14 days from the positive result? Like if you do, let's say during that isolation, you get tested and you find yourself positive, should there be another 14 days added on to that?
So if you don't have symptoms, the period of self-isolation or self-monitoring is 14 days. If you test positive, you are followed up regularly by public health and your healthcare provider. In some people, the symptoms may settle in a week and you get another test, which if it's negative, you're free to go about your daily work. In some cases, it may take 2 or 3 weeks. What we've seen with other cases in Canada, that people have cleared the virus, but it takes varying amounts of time, not just 14 days.
Quebec is thinking right now about having a 2-week mandatory isolation for anyone that's from the state that goes on an international trip. Do we expect some type of policy here of the same way?
So I have not seen that advisory yet, but at the moment, the 2-week mandatory self-isolation by the public health agency was only for people who are coming from those 3 countries I mentioned earlier, China, Italy, and Iran, and also people who are returning obviously from cruise ships that have had outbreaks. So that's either isolation at home or at Trenton. That's in a federally monitored setting. But obviously this is a dynamic situation, and we have to balance the inconvenience of saying everyone who travels has to stay home for 2 weeks versus the risk, which really is when you develop symptoms. But obviously we'll continue to examine this situation and advise accordingly.
Me?
Yeah.
What time and date did you exactly find out the presumptive test results?
The investigation was completed yesterday evening, and we confirmed that this morning with our partners, RRPL and other partners.
What time was that, just roughly?
Well, I was made aware that the test results are being completed late yesterday evening, but then we had discussions late into the night about confirming that the test result is presumptive positive, and in the morning we confirmed that the patient has been informed. Further details about travel are being confirmed, but we do have to make sure that the patient has been informed. We have to check in with the lab again to confirm that everything is what it is.
So the patient was in the process of being informed last night then?
Yeah, I think the patient was informed late last night. Yeah.
We'll get Arthur's question, and we're going to get Minister Reiter as well.
Could you speak to how confident you are that you'll be able to contain this before it begins spreading in the community? And sort of a related question, The federal health minister has suggested that this could affect between 30 and 70% of the Canadian population. Do you share that assessment, and would the numbers be similar for the province?
Okay, so there are kind of three separate answers to this, so you'll have to bear with me. Our first aim is to contain, which is what we're doing now. And we want to remain in containment for as long as we can. How long will you remain depends on all of us doing the right thing, which is if you have traveled and have symptoms, you seek advice, you get tested, and you self-monitor 2 weeks and self-isolate once you test positive. That's the first thing. We also want to delay. So what that means is that obviously other close contacts have to self-isolate. We also want to be very mindful of large events and other gatherings where if there's a risk, we want to put in either special precautions about how large events happen or may even consider canceling large events. So all that is to minimize community transmission. So that's, contain and then delay. Mitigation obviously is providing healthcare. Yes, for novel viruses, experts say that over a period of time, most people will get exposed to it. The aim is that everyone shouldn't get exposed in 1 month, because that will put tremendous strain on the healthcare system, and we want to spread the curve and flatten the curve over months to years, because then everything becomes more manageable, providing healthcare in the home, in the primary care setting, hospital, or acute care, all because, so those are the basic principles.
In this particular case, how confident are you that you've essentially identified the people?
We are confident in this case it has been contained. And for most travel-related cases, when people are themselves very aware to self-monitor and self-isolate if symptomatic and avoid large gatherings, I think those things are really important. It's not a good idea if you come back, you have a cough, to go around shaking hands at work or, go to gatherings. So I think those principles are very important, and if those are followed, we are confident we can continue to contain. But of course, we have seen in many parts of the world where community transmission does get established very quickly.
Do you require the individual to retest?
If you test positive, then you're followed up regularly till your symptoms are better, and then you are retested to make sure you've cleared the virus before you can go back to your daily activities.
Serious condition in hospital right now?
I'm not aware of those details, but obviously if we have anyone who tests positive and who is hospitalized, we will give that information.
If the pandemic plan here in Saskatchewan wasn't updated since 2009 prior to this, how could the province be prepared? There's so much more to consider now. We have the SHA being, this big governing body where before it was smaller health regions. Social media is such a big thing now.
I think there's certain things like that. It's easy to pick holes in it, but where it referenced the Regional Health Authority would have responsibility. Clearly, the Saskatchewan Health Authority has responsibility now in those areas. It wouldn't make any sense to me. There's generally emergency plans in place, sort of to cover any emergency, and then they're adapted for specifics. It wouldn't make any sense to me to completely throw out all the work that have been done and start from scratch. So, obviously, officials have been working on making the changes necessary to adapt to this.
Is it possible to just tweak a plan that, this outbreak could be, they say, 10 times worse than the flu, 10 times as deadly? How is it just that a tweak could?
Well, obviously, we're in uncharted territory, so when I referred to tweaks, I meant things like you were saying about Regional Health Authority versus Saskatchewan Health Authority. We rely on our officials to tell us what we need in these cases, and so that's why we have officials working on the different components of the plan. You saw the framework yesterday, and then there's the various documents that are appendices to that. So, you have to remember this is relatively new. It's been 3 months, Doctor, roughly. So officials have been working diligently to adjust the plan as necessary. Let's remember that we're in a situation right now where basically we're still preparing. Just today have a case confirmed, so we're still preparing for what the eventuality might be. We don't know how many how many people are going to be affected. Obviously, Dr. Shahab and his folks are preparing sort of to the best of their ability.
Explain how this first case influences the urgency of the planning process and the amount of resources that the province is going to bring to this.
I would say, you know, our officials have been treating this very, very seriously all along. You know, the expectation was that sooner or later we were going to have a case and likely more cases. So they've been working diligently on that. And as far as the resources, that's a very good question. I've made it explicitly clear to my deputy minister, to Dr. Shahab, to senior officials at the SHA that they'll have whatever resources that they deem necessary. No. Over the last period of time as we've been working on this.
Minister, can you walk us through the decision to postpone the spring election? Can you take us into the cabinet discussions and when this decision was made?
Well, a couple points. First of all, I can't comment on cabinet discussions. Second, there hasn't been a lot of discussion on that sort of thing. That decision rests with the Premier. I just want to reiterate, though, while there's been lots of speculation about a spring election, you know, the Premier said that there's a window there available should he choose to use it, but he always talked about the election set for October, I think it's the 26th, and it's his prerogative if he wants to pick a window to go sooner. He had never selected a date. The 19th that was going around, frankly, was floated by the Leader of the Opposition, not by the Premier. The Premier is always going to put the safety and security of residents first. With all that speculation, in light of everything that's happened essentially in the last 24 hours, he felt it was appropriate to put all that aside and just let people know that he didn't think this was an appropriate time and he wouldn't be exercising the window.
But we know that this was declared a pandemic yesterday, and the Premier was still able to provide a clear answer about whether or not he was ruling out an early election. Can you explain what changed between yesterday and today to make this clear?
Well, I think we lose sight of, again, the Premier didn't call an election. He never called one. The election was set for the 26th. Much happened yesterday that from a politician's point of view, it seems strange to announce that you're not going to do something. You know, as far as his exact thinking yesterday, everything unfolded very quickly yesterday, as you said, Arthur. I mean, it was announced that the World Health Organization considered it a pandemic. Lots of events were canceled, and yet people were still talking about, are we going to have an election? And I would assume by then that he probably felt that we weren't, but the fact it was still even having any discussion, he just felt it was best just to put that completely to rest.
Why did it take so long? There's been, for 2 weeks, climbing numbers of people infected with COVID-19. He's asked repeatedly to rule it out. So the speculation, one could say, was also fueled by his in-answers, and today was the first clear, direct line. So why did it take so long to put this clear message out there when he's had many opportunities up until now?
Yesterday, you heard questions to Dr. Shahab from media asking, and I'm paraphrasing, but essentially, an election needs to be called in roughly the next 6 months. When is the safest time period? And as Dr. Shahab had said, it's impossible to predict. So that's one of the things the Premier's had to grapple with. You know, you say that we've had our first case today. We don't know how many cases we're going to have 3 or 4 months from now or 6 months from now. So that's one of the issues he's had to grapple with. We have a time frame the election needs to be called in. When would be the safest time to do it? And brilliant medical minds are telling us it's impossible to know.
Yeah, Dr. Shahab also likened voting during a pandemic to going grocery shopping. Has your opinion changed on that?
Well, you heard the rest of the answer too. Let's not take that out of context. Let's bear in mind that no matter what the Premier does or doesn't do, he's going to be criticized. You're suggesting now that this may have been the wrong decision, and yesterday he's being criticized because he hasn't ruled it out completely. So it's a difficult decision to make. He needed to decide what would be in the best interest of Saskatchewan people. Obviously, everybody's very, very concerned right now, and he's decided it's important to let the people of Saskatchewan know that we won't be going to the polls this spring.
Anything about the
24
money?
hours, did either yourself or Dr. Shahab or any other health officials have a conversation with the Premier about the potential of putting out a clear statement about this and making a definitive decision?
Now, Dr. Shahab and I and the Premier have met a number of times over the last week or two, but I don't believe we did in the last 24 hours. I think the last time we met with the Premier was Monday with Dr. Shahab.
Do you know anything about the money that the federal government has said that they're putting aside for coronavirus, how much is coming to Saskatchewan?
I don't have an exact amount for Saskatchewan yet. My Deputy Minister conference call later yesterday afternoon, I think it was, with other deputies and some federal officials, and I know our officials are having follow-up calls. I expect that I'll get information from them fairly shortly, but I don't have a dollar amount for you yet, though, but we'll certainly make that available when we do.
Is that because we don't know how much we need, or because the federal government doesn't know how it's spreading?
I think it's a combination of both.
There's always been a fear around COVID-19, and maybe kind of subsided in Saskatchewan a little bit because we didn't have a case. But now that there is a case, and like all the planning has to come to fruition now to Saskatchewan to going forward now that there is.
I think the first message I would send to folks is that while we see this as a worldwide and nationwide issue, they can rest assured that our officials have been working diligently on this, not just since today, not just since the test case, but Dr. Shahab and his officials have been working diligently on this for weeks and weeks right now. We're going to make every effort to be as prepared as possible, no matter the number of cases that test positive. Rest assured that our officials are working to the best of their ability. Dan?
Were you informed of the Premier's election decision, and what discussion did you have with him about this?
Well, I'm not going to get into private conversations I have with the Premier, but I was first informed this morning.
Is there any consideration to postponing the budget?
We're continuously, Dr. Shahab and I've had discussions about that because we think it's important the budget go on, but the issue is, of course, there's going to be a crowd gathered in that case. So I think it's fair to say, I don't want to put words in Dr. Shahab's mouth, but that if we do go forward, it'll be with appropriate precautions taken. Things have changed rapidly in the last 24 hours, so certainly things could change between now and then. So I want to recognize that. I'm not trying to be coy. We intend on the budget going forward as far as how we deal with crowds in the building. We'll make that decision. Risk assessments are being done all the time for group functions. Dr. Shahab spoke to that yesterday in the scrum. I think it's fair to say it's possible things will change, but as of right now, and you'll be notified as soon as they do, but as of right now, things will continue as normal.
What changed since yesterday's press conference in the afternoon and today morning announced that the Junos were cancelled? What changed at that time frame?
That I would say, that could probably be put to the Juno organizers. They made that decision. Certainly we support that. A lot of decisions were made in a lot of jurisdictions yesterday with a lot of events being canceled. There's a lot of public anxiety over it, and I think they just felt that in light of that, it would be prudent to not take any risks, any level of risk, and to cancel the event.
Last minute a little bit. It's like 1 or 2 days before it starts.
I think it is absolutely it's last minute, but again, this issue changes not only by the day, it changes by the hour.
How much say did the government have in the cancellation?
There was definitely discussions. I know Minister Mikowski had some discussions with the organizers. I didn't, but I know he did, but my understanding is, the final decision was left up to them, but we're supportive of the decision they made.
Why did the Premier tell you he was making this decision?
I had a very brief conversation with him this morning on the phone. He's not in the province, as you know. We didn't get into details, nor do we need to. We both understand the situation very well.
What do you have to say to people, and I understand you're not the Premier, to people who felt misled and confused by the Premier's comments? Because he did leave the door open. There were many opportunities up until yesterday for him to rule out a spring election, and he did so in a statement when he's out of province. So what do you have to say to people who are confused, misled, a little upset with the Premier's handling of this?
I would ask them to look at the facts. The Premier's been very upfront about this from the start. At no time did he ever say that he was going to call the spring election. He said there's a window of opportunity open. There's several windows of opportunity. His decision needed to be the election set for October 26th. He has the prerogative to go at some point in a window earlier. The issue that he had to grapple with, and I spoke to this in the House in question period a number of times, is that he needed to make a decision weighing the fact that when would be the appropriate time that this would have the least impact on people. There is no way of knowing that. So he's been nothing but upfront. He has said clearly that I have some windows of opportunity. I haven't made a decision to go early. There's been so much speculation about this, and people reading into what he said that he had already made up his mind to go early. He didn't. There's been no election date set. It seems strange to say, why don't you cancel an event that's actually hasn't been scheduled? So, but with all the speculation going around, all the concern that people have about this, he felt it was appropriate to put something out publicly so people can rest assured that there's not going to be a spring election.
Projections in terms of funding to deal with this pandemic here in the province?
We don't have any exact numbers right now, frankly. We're at the point right now because we don't know how many people are going to be affected. So I've just assured officials, as I said minutes ago, that we just need to communicate about whatever resources they need.
How does it work for self-isolation? Is he getting provided by the province for the 2 weeks he's isolated, or is he getting free?
The province, the announcement the federal government made was there would be, under the EI program, that there'd be some provision made there. So I'm still waiting to see more information on that.
Regarding 811, a lot of concerns that the calls are getting cut off at this moment from people who are calling with symptoms. I guess, what is the government planning to do to help support or maybe shore up resources for line? I mean, obviously, that only works to a certain extent if people are showing symptoms. What does the government plan to do about it?
Yeah, absolutely. That obviously is concerning. Dr. Shahab addressed some of it. What we're going to do, my office was in contact with SHA senior officials today. I've asked for an action plan by tomorrow morning that I want to see what the plans are. We need to ensure that obviously 811 is going to play a huge role in this moving forward. We need to ensure that it's operating. At the same time, I would say to the citizens of Saskatchewan, please, we've had reports of people saying, well, I phoned in to test. Like, that's not an appropriate use of that resource at all. We're asking people to please use it when necessary. And I don't want to repeat everything Dr. Shahab said but much of the information is available on the website. But having said that, I should add as well, we expect there will be more demands on that, and so they're going to need to expand services. So we're going to ensure that they have all resources they need for that.
Asked for an action plan on 811 or
on 811, yeah. I just want to understand exactly where officials are looking at for the expansion, because we need to ensure that they have the resources.
Should other organizations be canceling events like minor sports, that kind of stuff?
I'll put that question to Dr. Shahab when we're done.
So as Health Minister, how concerned are you about COVID-19 spread in the province, and how confident are you will be able to contain it?
I'm obviously very concerned, but I have a great deal of confidence in our officials. You've seen the good work they've done already, and I have no reason to believe that'll change. Yeah.
Can you explain where we are in finalizing that planning document, like the actual
company? Sure. So you saw the framework was posted yesterday or day before, I can't remember, and then there's different components. So my understanding is a number of those components, starting next week, you're going to see as those are finalized, those will be posted online as well.
With regard to the framework, it says that you needed an inventory about some of the equipment needed to deal with a potential surge of cases. Do you have those numbers, like how many ventilators, how much PPE?
I don't, like, we'll see what we can provide to you. I know there, you know, specifics of the different types of resources. I'll see if officials can provide that for you. I know they've done that or much of that. I saw some numbers this morning on surgical masks, the kind of supplies we have on hand versus what have been ordered, those sorts of things. So we'll provide for you what we can.
Do you have some sort of estimate of what the surge capacity is? To Dr. Shahab, actually.
Sure.
I'll go to Steph first.
Did the Premier know we were likely to see our first presumptive case when the decision was made to officially directly rule out a spring election?
I'm not sure. I'm not sure when he and I didn't discuss that, although I'm sure he was informed, but I'm not sure when he was first informed about it.
And just to be clear, does the Premier bear any responsibility for the early election speculation?
I don't believe so. People are always going to speculate. I think back to, I've been a political junkie for many, many years, and I think back to a lot of years ago when Lauren Calvert was the leader of the NDP, and there was speculation for months and months and months that he was going to call an election. That kind of speculation, you can't control. People are going to do that. I think the Premier was very forthright with the situation, where he said he has a few windows between now and then, and he'd consider it, and he wants people to put the speculation to bed, so he's clearly indicated that that's not going to happen.
Saskatchewan Federation of Labour is calling on the provincial government to quickly adopt a law for paid sick days. What's your opinion on that?
We're going to look to the federal government for that announcement they made and see how that's going to impact people.
So just to be clear, Minister, the Premier saying our 4 years is up, I need a mandate, I want that mandate sooner rather than later, that's not speculative. That's not a speculative statement.
Well, Stephanie, I'm not sure what, you can ask the same question different ways. I'm going to give you the same answer.
On the record, would not consider that a speculative statement the Premier made.
He had a number of windows open to him, and that's what he stated, that he has those windows open. He's clearly said that a number of times that it's set for October 26th, although he had the prerogative of going early. He hadn't made any decision, so I'm not sure how he could announce it when he hadn't made any decision. And now, in light of everything that's changed, he felt it was appropriate to clarify it so that the speculation hopefully will stop.
Specifically, what is it that changed? Is it the fact that we now have the virus? Was it the fact that, like, the NHL and the biggest players in sports and entertainment were kind of kiboshing public events? Like, what specifically was there that made that triggered this?
Well, again, that was his decision. That question would be better put to him. But I think I would say that just simply the fact that we had been focused, our government had been focused on COVID-19. And yet at the same time that we're trying to take precautions, get messages out to the public, support our officials, at the same time, the speculation about an election continued. It's raised every single day in question period. And I think he just felt it's time to just be incredibly clear saying it's not happening.
You're creating a committee?
What's that?
I think we're good.
Sure. Sorry.
It was just in regards to the committee that came up, the NDP, they want to create a committee to kind of deal with this issue. Are you interested in that, or is it necessary?
Well, obviously, government's role is to support our officials to do the work. There's a number of varying levels of officials, different committees that work right now. The Premier may look at some type of committee structure if he deems it appropriate, but my understanding was Leader of the Opposition. I'll just be frank. It's hard to take it seriously to say we'll have a nonpartisan committee to work on this. At the same time, he's being incredibly partisan in the statement. So any committee appointments, though, obviously would be the Premier's prerogative.
We had a couple that were back for Dr. Shahab.
Yeah, I just wanted to ask.
Sure.
I just have one more for you. I'm just wondering if you can say how worried should Saskatchewan people be about this?
I would say, obviously, they should be diligent. They should follow the suggestions that have been made with social distancing and handshaking and washing hands. They should do all those things. But I think if people do those things, they can rest assured that our officials are working diligently to protect them.
Is that one for Dr. Shahab?
Yeah, so we'll just wait for the mic there. So yeah, I was just wondering if, first of all, you had those numbers that I was asking for about the equipment, and secondly, what the surge capacity of the system is to deal with an influx of COVID cases that would arise.
So the numbers, we'll have to get back to you. I don't have those. There's a question on mass gatherings and the surge capacity. So I think social distancing, the role of broader public health measures, and the surge capacity are all interlinked. Because as we said, if we accept that 30 to 70% of people will get COVID-19, we already know the percentages by age group who require various levels of care. 80% are fine staying at home. 15% require a high level of care for a few weeks, and 5% require ICU care. And we've starting to do projections and modeling by age group, because we also know that younger adults don't get as serious illness as older adults. So with that, all those projections in mind, the surge capacity will be significant if everyone was to get exposed within a short period of time, but it would be manageable if you could flatten the curve. And how you flatten the curve is with all the things we discussed, quick testing and containment of every case, quick quarantine of close contacts. But then if we start seeing community transmission, like we discussed yesterday, we need to be ready to take some tough decisions about, we are not there yet, but we need to be clear that if and when the time comes, we need to be able to take some tough decisions, which means that everyone in a particular area with community transmission, you have to stay home unless you are providing essential services, healthcare, water treatment, utilities. Those are the only people going to work. Everyone else stays home for 2 weeks, 4 weeks till this has, cleared through the community. You would be able to go out if you're asymptomatic to, shop for groceries and those kind of things. And we've seen that being put in place in China, in Italy. Those are very significant decisions. Those will not be taken lightly. But we have to be clear that if those actions do show impact, and we're getting some early data from Singapore and China and Italy, we still have to see. But we are getting that some of those interventions will have a significant impact on people's daily lives, can have some impact on flattening the curve. And then that has a direct impact on the surge capacity, because, and this has been said many times in the past, most hospitals are supposed to have a surge capacity of 15%. During flu season, sometimes they're at 100, 110%. That kind of flattens out a bit when flu season is over. But the estimates suggest that if this is 5 to 10 times more severe than influenza, obviously if it comes all at once, the surge capacity cannot be met. But then you plan for the worst case scenario, but you don't wait for that demand to go to that level. You have to put in community interventions to prevent that surge happening early. And I think we all need to start thinking about how we will deal with that, which really has to be that we remain calm and accept those decisions. So again, we may never have to apply them, or we may have to apply them only in a few selected parts of the province or more broadly. All those things are questions that we are thinking about very seriously in Saskatchewan, at a local level, in Canada, and also in other countries as well.
So what you're talking about right now are strategies that could avoid us hitting the surge capacity. Yeah. But what is the surge capacity? Like, how many patients can the system handle?
So the surge capacity, you have a certain number of acute care beds, but then you plan how can you deploy additional acute care beds. So there are ways of deploying those additional beds. Then you can delay, and all of this is always part of pandemic planning. Those evergreen plans always talk to these things, but now they are being specially looked at in terms of COVID-19. That you can always deploy more acute care beds by creating extra beds or bring them into service, but with staffing. You can change how staffing is provided, like you can have cohorting of patients with COVID-19 in one ward versus other patients in the ward. That makes care more efficient. You can also, and that is early on, but then if required, you can also cancel elective procedures. That frees up significant space in acute care beds and also ICU beds So those are all the planning assumptions that can increase surge capacity significantly, but with some impact on other things. It interrupts business continuity in terms of routine surgeries, and that then becomes a backlog that has to be met as well. So I think those variables need to be looked at. But I agree that when we look at Italy, their surge capacity has been, they're at peak surge, and we really need to understand from our the Italian experience and from other countries how we can, as much as possible, try to flatten that curve. But that requires significant societal interventions that we all need to then accept, which could be staying home for 2 weeks, 4 weeks, not going to school or work, just being able to go out and do your essential shopping. So I think that's things we all need to start thinking about.
Okay, thanks, everybody.
Thanks, Matt.
Good.
Thanks, Dr. Shah.
Thank you, Dr. Shah.